Hello, everyone. We are live. I was just waiting for the tornado sirens to finish spinning around. Welcome to our Lunch and Learn. My name is Stacy Nell. I'm the Executive Director of the Kansas African American Affairs Commission. I am thrilled to be joined once again by Dr. Sharla Smith of the Kansas Birth Equity Network. She's also a researcher at KU Med Center. Hi.
Hi. And I'm grateful to be a part of this conversation.
Fantastic. I know you were one of my absolute first guests way back last May is what I'm trying to say. And we just didn't have much of an audience. I have a little broader audience now. And so I'm like, I'm bringing you back on, quite frankly. I do want to read a quick bio. Everyone loves when I read their bio. Dr. Sharla Smith completed her PhD in Health Systems and Services Research with a concentration in Health Economics from the University of Arkansas for Medical Sciences in 2013. Dr. Smith is a health service and systems researcher whose primary research is maternal and infant health disparities, women's cancer disparities, and community engagement. She's the co-founder of the Kansas Sisters and Brothers for Healthy Infants and the founder of Kansas Birth Equity Network. Dr. Smith is passionate about developing a culture of birth equity through community engagement, empowerment, and education, which I am all for and love everything about. So thank you for coming on again today, Dr. Smith.
Thank you for having me.
My first question is always, what are you having for lunch?
I had leftover fried chicken with a little bit of mashed potatoes and a lot of broccoli.
There you go. Yeah, I've got some leftovers, and I also went over to the Capitol today, and there was a sponsored lunch, and I picked up a lunch. So I'm like,
well, that sounds great. I just had leftovers, so it was a very small meal, but enough to make sure that I stay woke the remainder of the day.
There you go. Fantastic. Okay, so now I brought you on, and we were just talking a little bit briefly before we came on. I brought you on and had wanted to bring you back because there was a bill that was going through the Kansas legislature dealing with maternal health outcomes. And so I wanted you to give a backdrop. Actually, let's back up and go a little broader and talk about your research into this area, and then we'll focus on what's going on in the Kansas legislature right now. So go ahead, give us a background.
Yeah, so my research has really focused around maternal and infant disparities. Particularly, I focus on Black maternal and infant disparities. So there's a lot of work in that area. And I always tell people that we focus on them because they deserve our focus, right? And so, of course, we have the Kansas Birth Equity Network, which focuses solely on engaging stakeholders in this work and defining what our goal is going to be over the next 5 years, how we're going to address this work. And so we have a 5-year research agenda. We are working with Healthy Blue to bring funding so that we can fund those organizations that are involved in KBN to do work centered around answering those research questions that are in our research agenda. We are also working to make sure that there is some engagement maps around how do we engage individuals more in this work. And so that's all exciting because the reality is that it is going to take all of us to reduce these disparities, but there needs to be a particular focus on Black maternal, paternal, and infant health. And so our work also includes paternal because we believe that every person that is involved in the family or the family structure should be a part of this work. And so we absolutely positively want to focus on Black fathers because they are involved in their children's lives. So changing that perspective. The overall goal of my work is to change the community perspective of Black families because there are a lot of strengths in our Black families across the state, and we don't highlight those strengths. We go into these communities with the idea that we're going to teach them how to be better parents, how to be better citizens, how to be better community members, when the reality is they already know how to do that, right? We have just failed as a system and as a part of a system in providing the resources needed for them to continue doing the things that they're doing. And so that is my goal, is to change that perspective of how we look at Black families in our community, and then also how we do the work. that we do the work where it's community led so that they are at the table early and throughout the work to make sure that we define that. And this is very important. The new data from the American Health Rankings says that Kansas has one of the highest maternal mortality rates in the nation. Kansas
Wow.
used to have their Black maternal mortality rate was 68 per 100,000 live births, but in 2022 it is 105.4 per 100,000 live births. And so we knew that there was going to be a significant increase because a lot of people contributed to the pandemic. But I think the reality is we've been talking about this for a long time. It's larger than the pandemic. But to see those numbers increase, I mean,
So
almost
I want to back up just to give some perspective or maybe some definition. When you talk about maternal mortality rates, are you talking about, just define that? Is it just dying in during childbirth, or does it takes up? So can
it's
you?
up to a year after childbirth. So it's the childbirth, of course, it's during the time during that perinatal period that you're pregnant, but also up to a year after childbirth. So those deaths are counted. Fortunately, this data does not look at up to a year after. And so that means that it's probably a larger number than what we see. But the reality is we need to do something different.
So this is, and I want to make this point because it lends to itself to the discussion of the bill. This is data that you got from a national. Can you just back up and say that again?
Yes, American Health Rankings, which is a national organization that releases this data. Usually it is about a year lag in that data, and they don't release it for every year. So the reality is we won't know the rolling. A lot of people say we like to know the 3 to 5 year rate, and that is what our states do, is they make sure that there's a 3 to 5 year estimate, so that because it is more accurate statistically. But I think this definitely highlights the increase in these disparities that we're going to see.
And then, gosh, that's shocking. I didn't know that number. That's pretty shocking. So the reason why I wanted to take pains to point out that this is a national reporting agency is because I know that the bill, I know the way it was written last year versus the way it was written this year. Last year it was SB 42. This year it's SB 118. Last year you were specifically asking for what?
We're specifically asking for transparent data. We wanted to know what the true rates were. And we were specifically asking for the overall data, the release of data, to have more access as those in the state that are doing the research.
Right.
And so that was the reality. And that is still in SB 118. I will say Melanie McCrae Miller leads those efforts, and Sapphire Elise and I and Melody work as a team to edit it. This bill is different though this year.
Right. But I wanted to back up and say you were asking at the state level, KDHE,
yes,
as opposed to the numbers that you just quoted were coming from a national level. So you were requesting that the state level, that KDHE would track specifically health outcomes for Black women. So SB 42 last year didn't make it out of committee, unfortunately, mainly because you were asking specifically to track Black women. So this year we're trying again with SB 118. How'd that go?
So SB 118 has not had a hearing, and mainly because the chairman of the committee said that there was a group, Do No Harm, that presented that Black women had these disparities because they did not access care. And that is absolutely not true. We know that from the data, but the reality is this bill does not mention Black women. It does indirectly, but it does not state Black. This bill is really focused more broadly. It includes rural women and rural communities, as well as tribal. And it also includes the other, what we call the underrepresented groups, which are Black women. But it looks at the overall disparities for our entire state, how we can improve coordination of care, how we improve data access, as well as including last year we talked about an external review committee, and this year we're still talking about that review committee, but not in the sense of adding more stakeholders of color. I want to note that KDHE has done a great job. They did a great job within the last year adding more individuals of color to the maternal mortality review committee. That is difficult everywhere, but they did attempt to implement a lot of the things that we put in the last year's bill. And so they've done a great job with things, but there is still a need for representation from our rural communities, from our tribal communities, as well as special expertise that are not at the table, that oftentimes when we're reviewing cases we'll say, "Man, I wish that we had this person here," right? Or we wish that we had this expert here. And so the reality of having those experts at the table is really important. The other thing is looking at generational trauma.
Mm-hmm.
Kate, last year we included a social determinants of health form in that bill to be included in the maternal mortality review committee, because we just were not looking at the disparities in detail and looking at racism and biases and how that and discrimination and how that was contributing to birth outcomes. And they did include a social determinants of health form, and they were very instrumental about talking to their committee and making that more comprehensive. But we really need to look at generational trauma, because what we're seeing in our new data is that Black wealthy women are still having worse outcomes compared to poor Hispanic and white women. And this is new data. This is not data that was years ago. And so we really need to look at what's happening in this generational component of this, and look at these disparities more in depth. And these the social determinants of health need to be expanded, because with Black women, we don't often see the social determinants of health at play. In our outcomes, we find that Black women in wealthy communities have worse outcomes. We find that Black educated women have worse outcomes.
Do
We
you have
find
any
that Black
ideas as to
women who,
why? I mean, as a Black woman who's given birth twice in the state of Kansas, this is to me why this is something that I pay attention to, right? I mean, I do. Is there any? And I knew that. I remember very clearly knowing that some of the stats before when I was pregnant, and thinking, okay, the odds are against me. The odds are against me just being a Black woman in America, period, not just Kansas, being a Black woman in America, period. The odds were against me um, giving birth. Like, and my husband and I had a conversation. I was like, listen, if something happens to me, like we had that conversation, if something happens to me, follow the baby, right? Like if I'm gonna die here, you go take care of the baby. Like I sort of counted the cost on that. But do we have any idea as to why the outcomes are so poor? And like you said, I
yeah,
have access to care. I mean, I don't know if I'm wealthy, but I had prenatal care. I had access to care. But I also chose a OBGYN of color.
yeah, I mean, there's a number of factors, right? We know that Black women have more stress on their bodies because of the racism that they deal with every day. It's not just we talk about the healthcare system, but we have to live in a society that doesn't really support us, right? And so we have these experiences in our daily lives, whether we're at the grocery store, the gas station, walking in the door of a store, being followed around stores. We talk about, police brutality. We talk about the stress that we have in raising our children because they are Black, how the experiences we have in our community. So we have these experiences every day, which are stress. And it becomes trauma that's carried down from generation to generation, right? And so we have those issues. We also have a lack of representation as it becomes to providers, right? And so we oftentimes don't have the ability to choose a provider of color or to choose a provider that has experience with working with people of color, right? There's a lot of discrimination and bias in our systems that a lot of systems are working to address, but it still exists. Of course, we know about the history of Black people receiving care. So that of course, makes us think twice about seeking care. We experience, no matter how much money you have, I still experience discrimination in my care. I have a Black son who's a young adult who still experiences discrimination, whom I still often go to the doctor with because of the assumptions, right? It's just, these are the experiences that we have, and they're definitely detrimental to our health, our mental and physical health, and it just comes out and when we're seeking care. But definitely, we don't see the social determinants of health. We see more of, whether you want to call it discrimination, you want to call it bias or racism, it still is what is causing these outcomes, and then we see it happening over and over. We're not listened to, and when someone does listen, they don't really hear us. They don't really value the Black body, right? And the other thing is, I heard you say I had a conversation with my husband, right? We don't talk about this past the woman dying or having a severe maternal mortality morbidity outcome, right? We don't talk about the impact that it has on the Black family when there is an outcome of such, that causes some long-term effect,
Right.
health effect, or when a mother dies. We don't talk about the after. I think the aftershock um, documentary focused on that, but as a state, we don't talk about that. We also don't talk about health in a general term. Thinking about some of the wins that Kansas has had with the tax decreasing taxes. There's still a lot more work to do around that, but that is a significant part of health, right? Being able to afford groceries, being able to afford
Hmm.
the things the necessities of your family. We shouldn't be one of the four states that has the highest grocery tax.
Yeah.
Um,
So there's a lot of things at play. Hmm.
yeah, Medicaid expansion. We need to talk about
Yeah.
what happens the year after. With Medicaid expansion, women are able to get care for up
Right.
to a
So
year
Governor
post.
Kelly got expanded for postnatal out 12 months of Medicaid expansion, but uh, which is good. let me not put a but at the end of that sentence. I should say it's expanded out to 12 months, and I'm going to put a period on the end of that sentence and say that's good, and put a period on the end of that
But
sentence.
that's temporary. It's a
Yeah.
budget provision. It's not Medicaid expansion.
Right.
And it's because our
That's
governor
the other, yeah,
understood.
that's the other side of that coin.
Yeah, the governor understood the importance of it. But what are we going to do as a state to make sure that that stays in place?
Okay. So
That is
that's
something we hadn't talked about.
and that's the situation with the Kansas legislature right now, is that the bill has once again stalled. It stalled last year. The bill has stalled again this year. This is what's called turnaround week, which is just a fancy word that says that if it doesn't get out of committee this week, it's not going to go anywhere at all, which would be disappointing. And but let's turn away from the Kansas legislature and talk about your work with the Kansas Birth Equity Network. I've been following. I go to your meetings. Again, as a Black woman who's given birth in the state of Kansas, this is work that's near and dear to me. I don't know if I necessarily always add a lot of value to your meetings, but whatever I can, have you come on the lunch and learns, let people know about what's going on with your organization, how they can get involved. So tell us about the work with the Kansas Birth Equity Network, and I know you have at least one event coming up that we're going to talk about.
Yeah, so the work continues. As long as there are disparities, we are doing the work, and we're really focused on Black women. Currently, we are planning our Black Maternal Health Week event, which will be held in Wyandotte County. It's the county with the highest Black maternal morbidity and mortality rate, and infant mortality. So we want to focus in those areas. But this year we're doing the event different. We usually have a conversation with lived experience. Conversation around what people have experienced in Kansas, and I think that has been great. And we will continue to have those conversations to bring awareness. But this year, we're going to have a keynote speaker, Stacy Scott, who's going to be talking to us about some wins. We want to talk this year, focus on some things that have gone great for Black maternal health, and on a nationally have gone great. And so she's going to present a lot of the birth equity work that she's been focused on, as well as some of the work with systems and how that work has improved health outcomes across the nation. And then we're going to have a panel, and that panel is going to be around policy, around funding, around healthcare, around lived experience. So we will have a lived experience individual there. And the reality is, we want to talk to them about the work that they're doing, as it relates to birth equity, because we want to make sure as a state that we're all focused on these issues. So some of the work that they're doing, as well as like how do we begin to improve as a state and work together, because we have to change policies.
Mm-hmm.
And as you can see with SB 118 and 42, there's we're not able to move the needle if we don't change policy, and we have to begin to do that. We also have to begin to have more organizations who are funding work across our state focused on birth equity and focus on Black maternal health overall, which means focusing on Black families, right? And so that's the reality of it. And then, of course, we always want to bring the healthcare perspective because it is very vital to our work. We still have to, receive and seek healthcare. And there's always a lot of questions. We had one at the Black Legislators Day. What do I do if my healthcare provider mistreats me? The answer is you change providers, but you need to hear that from providers because there are some providers that are of color and not of color that are really want to provide quality health care. And if you don't know any, contact me because there's some great providers here at KU that does that. And then to have the lived experience person who's also doing a lot of work in the community, health worker within our communities. And so that is very important. So we'll have that conversation, and then we'll have yoga. So the idea is to have a little yoga after just to de-stress. There will be food, so we will be serving a meal, and there will be prizes for families. This is for all families, so it doesn't matter.
Food, yoga, prizes, and information. I mean, come on.
Yeah, nothing gets better.
Civic engagement with food, yoga, and prizes.
Yes, food,
Is
yoga.
there a better way to spend a day?
And it'll be at Memorial Hall. So we're excited about that, large enough venue for us to have, as well as time for us to get together. And this year, we're really focusing on healthy, thriving Black futures. So we are no longer focusing on what's wrong, right? We don't want to talk. We want to talk about like what wins we've had as organizations, what wins we've had in our community. We really want to begin to celebrate our communities more because there are a lot of great things that are happening and things that are changing. Of course, we will present the data. We always present the data and we always state how important this work is, but it's an opportunity for us to come together with one mission, which is Black women are dying in the state of Kansas. And we, as a state, everyone in the state, regardless of race, gender, need to do better because we cannot no longer, let this happen. When Black women thrive, we all thrive. So the reality is we want them thriving, and they shouldn't be giving birth. That is supposed to be the most precious, celebratory time of your life. You should not be worrying about whether or not you're going to die.
It is amazing how truly hazardous to a woman's health giving birth is. Again, going back to my experience when I was pregnant with my first child, finding out that even outside of America, and my first child was 5 years ago. So my first child was, not 5 years ago, 14 years ago. But that it was like worldwide, pregnancy was like the number 3 killer of women. Like that statistic floored me. And then inside America, you'd think, well, of course, women shouldn't die in childbirth inside America, but they don't. But I'm thrilled to hear that you're doing focusing on the good, because it can be really depressing to focus on the bad. So that is fantastic to focus on the good. I do have the flyer. Should I put the flyer up?
Yes, share the flyer. And the registration link is open. We are working on another flyer that will include all of our guests, all of our panelists, as well as our keynote speakers. So this is a free event too. So it's absolutely free. It's on a Saturday. You can come, bring your children, no matter what age. It's family friendly. We'll have food. We'll have free. Of course, there will be swag. So the swag is free to all, but there also will be gifts for families because that's what we're there for. We're there to support families, and families are faced with, just like the rest of us are dealing with inflation, families are dealing with inflation. So our goal is to make sure that we have something to support our families there. And yoga, I mean, you can do yoga without, changing clothes. And so the idea is to just have a de-stressor there and to have some very affirming moves for Black families. But it's not just for Black families. I want to emphasize that this is for families in the state of Kansas, no matter where you live. You can come and we will be happy to accept you here and to have you be a part, because it's going to take all of us. Mm-hmm. So if you're doing work in this area, if you have a family, if you support a family, if you're part of a faith-based organization, we want you to come out and just enjoy this event. There will be a lot of conversation. So our keynote speaker will only be about 10 minutes giving a talk. A lot of the time will be focused on giving the audience the opportunity to ask questions to our panelists as well as our keynote speaker, and then just having a general conversation around this because that's what it's going to take. If you look at the data, it says that the reason we're losing a lot of our telomeres, which are our chromosomes, are being shortened, and so that means we're aging faster in the inside, is because we don't talk about the experiences that we have in our communities. We don't talk about the experiences we have with our providers, and so this is an opportunity for you to talk about those experiences and not age so quickly in the inside. I know that we age well outside, but we're aging quicker in the inside.
Right.
So this is an opportunity to have those conversations and not do
All right. Now I'm going to put your email address. I took it from the website, the SS Smith or with S Smith 37. So if you have any questions for Dr. Smith, or if you want to get any more information, especially about the Kansas Birth Equity Network, please contact her. I dropped her email into the comment box here. And really the community engagement aspect, I think, is so key. Getting more people involved in this work, getting more eyes on the work, getting more people just knowing about options that are available for us as women who are giving birth or birthing persons, I think is the terminology. It's a little more inclusive, which I am all for. And so, yes, definitely. Thank you for the work that you do. Honestly, I am so grateful. I'm going to take this slide down so I can see us. Thank you for the work that you do. I'm just grateful that to know that you're out there doing the work, you and Melanie McCrae Miller and Garcia, Sapphire Garcia Lice. Everyone's got three names. You only have two names, Sharla Smith.
I have two names.
But thank you for doing the work, and I really do appreciate it. Is there any? I know I wanted to mention, because you talked about the Black Maternal Week, but are you doing the Celebrate 366 this year too?
Yeah, so this year we have been partnering with the Heartland Conference. So that's in September. We have the Birth Equity Summit. So we'll be doing that again. The Celebrate Day 366 has turned into the Birth Equity Summit, and it's focused on Kansas as well. And so that will include, of course, our birth equity speaker as well as our panelists. Will be another opportunity to have a conversation around birth equity. We have the walk, the Birth Justice Walk, that happens in solidarity, that we all support these efforts. The idea this year is to also have something family friendly. We want to make sure that we get families out. We want more participation from the state because we are having these opportunities. I'd also like to mention that with our Black Maternal Health Week event, we will have vendors, and those vendors will not just be maternal and child health organizations, but we're bringing in Black-owned businesses just to make sure that we have those at the table of things that you need. My idea is always to have, bankers there. People don't have checking accounts. We need to figure out how to address all things with families. Get a realtor. How do you purchase your first home? We need to have those things when we have events because they're important factors in our lives. And so to keep our communities thriving, right? We want to have those. And so it'll be an opportunity to do that. But if you're not able, or if you're able to make that, come out. And also, save the date for September. It's usually the first week in September that we have the Birth Equity Summit.
So I put the link to your website and programs in the chat. So please do navigate over there and spend some time looking through the KBIN's website, which has a lot of information. And I know you'll be posting about that as we get closer. And then again, if anyone has any questions, I've put Dr. Smith's email address in the chat box as well. So please, in the comment box as well. So definitely contact her. Is there anything else that you wanted to advertise? And I think I may just here at the end, I'll throw this flyer back up one more time, just in case someone said, "Oh no, I don't know."
Well, if you are interested in this work, or if you want to become an integral part of reducing these disparities and strengthening our communities, I just say become a part of this. You can go on our website and you can sign up and say that you're interested in this work, and you can join us for our bi-monthly meetings and become part of the work. The work is bigger than just, the Kansas Birth Equity Network. It is about the state. We've done some amazing work. We have created labor and delivery birth equity statements for For KU, we have a clinical scholars program where we are taking residents and fellows into Black communities to learn about the communities that they are providing care to. So there's a lot of work happening. It's not just centered around community, not just centered around research, and not just centered around healthcare. It is encompassing of all and policy work, well, more like advocacy as a private citizen because we work for a state institute, but it is encompassing of all. And we really do want as many people that want to be a part of the solution at the table. And remember, if you're not a part of the solution, then you could often be a part of the problem. And we don't want to do that. So it's important that we're all at the table and that we all understand that when Black women thrive, we all thrive.
All right. Well, thank you very much. Thank you very much, Dr. Smith, for coming on today. We're here at time. We're at 29 minutes and 50 seconds, so we're doing pretty good. I do want to. I guess I'm not promoting anything right now. I'm not promoting Black Legislative Day or the survey, but I want to just thank everyone who did come out to Black Legislative Day. We had over 100 people there. It was really well attended. Dr. Smith was one of the presenters, so I really appreciate her taking the time to come over and be a part of that day. And we will have them in the future. So thanks everyone who came out for that. We'll have other events going on in the future, which I'm sure I will just promote shamelessly, but thank you, Dr. Smith, for your work with the Kansas Birth Equity Network. And I will see everyone next week for our Lunch and Learn.
Yeah,
okay.
Thank you.